So again, today, I think what we want to talk about is what are the models and what are the methods that continue to emerge and get tested about how we can look at the transport system, the transportation system, and the impacts we know that it has on people's lives, and in particular then in return on their health. And so there's an emerging tool you may have heard before, maybe for the first time today, to really quantify more comprehensively the health impacts from transportation planning. Scale is always an issue. And so today, what we're actually really thinking about is, and talking about, is a tool that's focused on regional level transportation planning, which is a really nice fit with MPOs, with regional transportation plans, thinking about that work too. The work that we're presenting today builds on kind of a long piece of work that's involved a lot of people from the local to the state level in Massachusetts, but in particular has really been advanced by a team that consists of the 3 or 4 professionals that you see here coming from Yale, UMass, and doing different work in different parts of, whether it be the air quality pieces, the physical activity, the crash pieces that are part of this too. And so we'll get into more detail of that, but we just want to make sure we take our hat off and say thanks for the work they've done to really advance and clarify this tool for Massachusetts. So we're going to spend, as we get into this, we just want to kind of ground everybody again. Some may have seen this before, but we want to ground everybody again too, and why we're talking about transportation and health, and what is kind of shared, and what are the effects of both and the benefits of both when we think about them together. So it's always helpful to clarify what we mean by health. I'm just going to read the statement. It's from the World Health Organization. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. At least from the MAPC side of the public health team, we operate from this definition, and we think it's a really important place to operate from, because it is not just the fact that we're keeping people from getting sick, but we're actually thinking about the other side. What are those things that keep people well, and how do we make contributions to that? That how is very relevant to the work that we do, that you might be doing at CTPS, is because as research continues to emerge, it continues to show that when we look across a large community like a city or town, or we look particularly across a large region, and we look in aggregate across all those people, what are the things that seem to be most contributing to people's health and well-being? So that definition, both kind of the absence of infirmity, as well as their social, physical, and mental well-being. And it turns out the pieces that are related to that are really coming from the environment that we live in, whether it be the physical environment, like the transportation system, the behavioral factors that are then enabled by essentially that physical environment that we have, and then the social connections that we have. The other two, again, genetics maybe being outside of that a little bit, but research also shows that the environment exerts it on that. Even places like healthcare, we can see in the current moment that some of that is really affected by where you live and what you have access to. And so what are those services that are available? And so when we think about how, again, we relate to that definition, we're making significant contributions all the way from kind of the ideas we bring together, the plans we put in place, the funding we might see through, and then there's actual changes we see in the world that's around us. And that's really a big contributor to our health. When we look at this work, we also have to kind of break it down a bit more to think about where is that place that we're making improvements and that we're making interventions. And so sometimes we'll talk about that as almost like a river and thinking about where we're seeing pieces. And so sometimes when we talk about downstream care or treating of symptoms, that's when we're really thinking about healthcare. How's healthcare helping us in a moment where we might find ourselves ill or injured, or a place where we really need intensive care? If we go a little further upstream, we know that, again, if that physical, social, behavioral environment is playing a key role, that's a place where we can also make provision for people. So this, again, thinking about the work that we're going to touch on today, what's the role of transportation in providing access and providing opportunity for people to be physically active, or having people essentially to be able to kind of go and take a walk or walk across the street and talk with their neighbor or visit a store. Those social needs are really important. How is the environment doing that? And so that's kind of, we would consider that midstream. But then upstream, we're then really thinking about what are the policies, what are the systems in place? How are we emphasizing the use of active transportation modes in general? How are we facilitating how our communities are constructed? How are we creating policies that create opportunity for people to be out and about, to feel safe, to also feel secure and included in their communities? And so we think about each of those levels and where we're working, And we tend to think about at a regional or community level, some of our greatest impact can be when we're working upstream or midstream. That's really where we can affect a lot of people through essentially the interventions and the improvements that we make. And so that's something that we're going to talk about, and the tool that we'll get to really focuses on thinking about those mid and upstream impacts. A couple of years back, MAPC did a health impact assessment for something called the Healthy Neighborhood Equity Fund. And through that, we kind of had the opportunity to identify 12 pathways that we thought were really important for connecting people to health. Again, thinking about that social, political, physical, and behavioral environments that folks are in, that comprehensive picture you see here. But in particular, when we think what's relevant to transportation, to what you might be encountering each day in your work, to the projects that seem essentially to kind of be on our plates, either coming from the municipalities we work with or coming from the state, there are three issues I think that really emerge strongly when we think about transportation, that being walkability and active transport, safety from traffic, and air quality. And that's really going to be the focus of where we go with these next couple of sections. We're often, again, on the health side of things, thinking about health outcomes. And it can be easy just to kind of leap there, but we want to understand some of the mechanisms that get us to those health outcomes rather than just talking about them conceptually. And so sometimes what we'll put together is what we'll call a pathway diagram. It's a way for us to understand what those are connections from the decisions we're considering, what we then put in place, and then the behaviors and what they enable, and then the health outcomes that are attached to them. So working from left to right on this particular slide, you can see where policy and planning interface. So decisions we're making around infrastructure, what type of transportation we're making available, how we're affecting and kind of what we're dictating around kind of design and land use based on our transportation pieces. Through the research, we know that they then enable or potentially distract or take away from people being able to engage in a lot of other behaviors that, again, we know are important. Those are the things that we're looking for when we do this work. So whether or not somebody is walking or driving, if someone's taking transit, whether someone feels like they can go and use the outdoors. And in doing so, we then actually see that there's a number of pathways through which that can really work. And again, bringing us back to what we'll focus on today and the focus of ITHIM, thinking about crashes, air pollution, and physical activity. And when you look at those connections, you can connect to both kind of premature mortality, or what that means is that someone doesn't live the life we would expect them to live. They often measure theirs around living to the age of 75 in a way that you're not being affected by disability because of the environment around you. But then also in some cases that can lead directly to essentially the fatalities, and we see these differences. There's maps of the United States where you can see vast differences of 8, 10, even 15 years in neighborhoods that are not too far apart, and begin to think about upstream pieces like the policy and planning and how that's set up the context for that work. We would be remiss if we didn't think about the current moment and connect some of those planning and policy decisions to what we see now. And realizing, again, transportation is not the only sector that makes contributions to that. But when we look at things like air pollution, there's a really strong correlation right now at the moment between places that have high amounts of air pollution or places where we know residents are exposed to high levels of particulates, particularly a contribution there being traffic related air pollution. Again, we're seeing people suffer more. And so that doesn't mean necessarily that they're at risk for greater infection at the current moment, but what it does mean is because of their risk factors related to that exposure, it makes them much more susceptible to experience a more extreme form of the impacts of that disease. Similarly, some of these chronic diseases that we focus on also indicate that we're seeing people be hospitalized more. If they have conditions such as hypertension or diabetes, we actually see that playing a role. And so we're not just talking about in the moment of exposures from environmental exposures, but we're thinking about what are some of those chronic conditions that our environment has been contributing to and might have been poorly positioning someone to be able to recover or be able to fend off some of the worst cases of COVID. So it has a current moment, but you can also see these longer term trends that are adding into what someone might essentially experience or be at greater risk for in the moment. I'm going to pause there for a second and just check back to see if there are any questions initially raised or anything coming up in the chat that we might clarify, knowing that we'll have a larger discussion at the end.
There are not any questions in the chat box at the moment.
Okay. And I also understand that was a lot of information. And as just again to reiterate, we'll be making this recording available as well as the slides. So if you want to kind of revisit and kind of go back on this information, that'll be available to you. So with that, I'm going to kind of turn it over to Sharon to begin to walk us through kind of those three main focus areas that are in front of us for ITHIM. I'm going to turn it over to you, Sharon.
Thank you. So yes, as Barry mentioned, we're going to focus in today on air pollution, traffic safety, and physical activity. So the first of these is air pollution, and I imagine that this is something that you have encountered as transportation planners and engineers, the connection of air pollution and transportation. But what we're really going to dive into right now is the links of air pollution to health and as a pathway of moving from transportation to health. Miscommunications in our advancing the slides. So what you see here is sort of a schematic of what we think about when we think about air pollution. So all the way to the left, you see a city. It happens to be Boston, and it looks like it's rush hour or really just any hour of traffic in Boston. The point here is that there's a lot of transportation related emissions, especially in the air right over that busy highway. So if you take your magnifying glass and you zoom in on that air, what we see going on is represented by this cartoon image of air pollution in the middle. What you're seeing here is a mix of particles and gases, some of which are listed to the right, so you can look at the color codes. These are just, air pollution as we think of it is an agglomeration. If we zoom in closer on those black dots, what we're seeing is essentially what comes out of a tailpipe. This is black carbon. It's perfectly spherical. They tend to agglomerate in the atmosphere, and as they build up, they get condensation, deposition of different compounds, and it becomes this really rich composition. So we are going to have things like inorganic and organic materials, metals, and all suspended in gases. As these depositions and condensations are released, they form particulate matter, and the size of which determines what's the terminology we use to refer to it. So the term that you're probably most familiar with is PM 2.5 or particulate matter 2.5, and this refers to particulate matter with a diameter that is less than 2.5 microns, and it's also referred to as fine particulate matter, and this is a key metric for traffic-related emissions. When we talk about air pollution, and this is going to be, we're going to talk about mostly PM 2.5 for the rest of these today, and then also going into the next few webinars. But we're going to express air pollution levels in terms of concentrations. So down there you see a box, and it's just to represent when we think about PM 2.5, we're thinking about units of microns per cubic meter. So that's the total mass of particles in a 1 cubic meter box. And so when you see graphs going in for the rest of the presentation that shows PM 2.5, that's what we're talking about. We're talking about that concentration level. So altogether, this is what we are talking about when we're talking about air pollution as an exposure. Next slide. So this is a still from a very cool YouTube video animation that I have the links down there, and we're going to send these slides out after, so I encourage you all to take a look. It comes from research from King's College London, and I think it does a really great job in showing you how transportation related emissions are distributed across the city. So those red lines, you're effectively seeing a roadmap of the city highlighted by high levels of PM 2.5. So red being high, blue being low, and yes, there's a fine spatial gradient across the city, but you're seeing a really high concentration that's effectively making a roadmap of the city. Those big red clouds that you're seeing, and you can see very nicely in the animation, they're at intersections, and you can see there the influence of acceleration and stop and go traffic. In the animation itself, if you zoom around, you can even see at different sides of the intersections, the different roles of how traffic is managed at it. And why I'm showing all of this is just to really get at this idea that although personal exposure is determined by air pollution, a lot of this is coming from transportation related sources, and it's not evenly distributed across a city. So when we think about air pollution exposure, and we think about it especially in urban settings, near roadway is where we're going to be having a bulk of that exposure. Next slide. So this is again an example of research that came out of King's College London. And this looked at black carbon as a component of particulate pollution. In this researcher gave GPS monitors to participants for the same 24-hour period and just measured exposure for every second of the 24 hours day as they went about their lives. So all of the participants, they lived in suburban London. They had similar ambient levels of pollution at their residential address. So he was trying to capture what were the different exposures from leaving their place of residence and going about their day. So of this list here, I'm gonna actually just open up a poll if I can. Yeah, a poll. So I'm gonna launch it right now. So of all of these workers here, so we have a nursery toddler, so not workers, nursery toddler, central London office worker, a home worker, a cycle courier, an ambulance driver, and a retired pensioner and a school pupil. Who do you think would have had the highest exposure to air pollution? I'm going to give you about 15 more seconds. Okay. So as you see, the most of you have selected cycle courier and ambulance driver. And Barry, if you could click. Oops, went too far. Go back one. You will see that it surprisingly is not the cycle courier, it is the ambulance driver who is on the roads in traffic all day. And the lowest was the central London office worker. So if we look at how that looks like across the day, Barry, if you don't mind advancing. You get a really nice picture of the cumulative exposure across the day. So as you saw, ambulance drivers highest level, and what you're looking at when you look at that olive green line across that graph is you're seeing that they're having high levels of exposure throughout their working day. So at the end of the day, they're having very high levels. And if you compare that to the office worker, who is that sort of purplish bluish line on the bottom, they're getting exposure during their morning commute, at their evening commute, and looks like even over their lunch hour, but pretty much when they're indoors, their exposure to air pollution is negligible. And you think about those commutes as the times that they're outside, they're being exposed to air pollution. And it just sort of drives home the role of roads in our personal exposures to air pollution, and gets at this idea is it's not just differentiated spatially across the city, but us as individuals have differential exposures, just how we live our day-to-day life. And I just, before we move on, want to also draw our attention to the nursery toddler, who is that red line in the middle, to drive home that even young children are having fairly high levels of exposure. And this is significant because when we think about different people over different life stages, even if they're exposed to, say, the same amount as that cycle courier, the nursery toddler has a different susceptibility and vulnerability to this level of exposure. So as we talk about ITHIM and as we dive into a little bit of the health effects, we have to think about it's like a spatial variability, personal variability, and also life stage vulnerability that we're taking into account with these health impact models. The next slide. And this is to just, again, attach this to the current moment, where we see clear that it's not hypothetical, the role that transportation is having on our air pollution. These are both images from the NASA Visualization Studio, and you look at 5-year averages for March of nitrogen dioxide, and you see that there is very high levels, especially around the New York area and somewhat in Boston as well, but continuing across Connecticut, Rhode Island, down into Maryland and Delaware. But if you look at what went on this March 2020, when we were all on lockdown, we weren't commuting to jobs, recreational travel has also decreased. You're seeing a significant drop in nitrogen dioxide, and it just shows us like what are day-to-day transportation trips, the impact it's having on air pollution in our region. Next slide. So how does air pollution relate to health? So the main exposure for air pollution is inhalation. Air pollution is going into the lungs, and once in the lungs, there's a lot of oxidative components which release oxidative stress, which leads to a number of respiratory outcomes. This is thinking like asthma, COPD, and lung cancer over the long term. But we can also have secondary effects. So particulate matter has these very, very small, includes very, very small particulates. And so some of these particles are able to get into the deep lung very efficiently because of their small size. And if there's sufficient concentrations of them, they can then break down the blood lung barrier and get into your circulation. And once in circulation, they're able to get to pretty much any organ system. And indeed, when we look at health outcomes related to air pollution, we're seeing a direct link to many organs. So primarily, we think about cardiovascular, about heart health. So we see connections to heart attacks, arrhythmias, strokes, but there are also impacts on other organs as well. Via the nasal cavity, air pollution can get into the brain, and we see impacts on neural behavioral effects, such as dementia and depression. And as we clear pollutants from our systems, it's going through our bladder and kidneys, and there we see links to various forms of cancers. And so again, this is a high-level look of how air pollution is entering and impacting our bodies, but noting that where you are in your life, these impacts may vary, and that we have enhanced susceptibility to all of these impacts amongst the very young and the very old. With that, Barry, I'm going to hand it back to you to talk a little bit about physical activity and traffic injuries.
Thanks, Sharon. So building off of what Sharon just shared in terms of bringing that impact directly into like an individual in a sense of how that's affecting our bodies, being active, again, we probably know this, but here are the various ways in which you can be active. Being active can really affect your health too. Again, it can have that role in a variety of different ways, but it's kind of very simple to explain is the sense of the fact of how often are we exercising, how intense are we exercising, and essentially what's the duration. And by exercising, I should actually say being active in the way that we're being physically active in that part of it too. And when we look at this, there's some kind of clear thresholds we can see in that idea that if you have 150 minutes of moderate physical activity in any week, you set yourself up to be at a much less risk for a lot of the factors that can kind of drive our health in bad directions too. And so thinking about things like not getting enough physical activity or the right kind of physical activity can be connected to heart disease, so issues like hypertension. It can also affect essentially how our body functions in terms of our sugars. So again, we've got like type 2 diabetes. It can also relate to the variety of cancers that we can get, as well as it actually has effects on our cognition and mental health as well too, really that idea. And in combination themselves, it can affect essentially how long we live and the quality of our life, and really kind of, again, the risks that we might make ourselves more susceptible to. And when we talk about physical activity, it's really interesting where essentially like any physical activity is better than no physical activity. And so that's an important thing. We gain things again along the way, but we really actually see the greatest impact of physical activity in moving people who aren't really doing any physical activity to getting some physical activity. And so really that is a benefit that you get once you begin to be active. And the relationship and benefits are really, really important, particularly again, getting that standard amount of activity in any particular day. And so you can see the graph here too, that again, you get some real great benefits in terms of what you're doing, but the higher ender you get, particularly in that middle part of like 150 to 300 minutes of moderate physical activity, again, that sets you up for a much healthier life of part of all this too. And so it's coming from physical activity guidelines, but also related to a lot of research that has gone into essentially physical activity and the impacts that we might see. The unfortunate part, I think, is that what we realize is that a majority of people are not getting that level of physical activity that we're looking for. There's an estimate that about $117 billion in annual healthcare costs and 10% of people dying prematurely is the failure of actually getting aerobic physical activity into their lives. And so that's why those guidelines and those standards on a weekly basis are really, really important. So by simply getting people into places that allow them to be more physically active, encourage them to be more physically active, we can actually save billions of dollars that we spend on our healthcare, and actually think about all the lives that we can impact essentially and have kind of longer and both kind of higher quality lives as part of all that. We are kind of moving in that direction, but again, because as we go back and realize of whether or not our physical environment, the transportation structures we set up allow us to kind of move in that direction, particularly as part of our daily routines, we know that we can make even more progress in this particular regard. And you can see that particularly when we think about mode share. Just the idea that, again, that people are spending so much time in vehicles, maybe not at the current moment, but under kind of the normal circumstances that existed before and those that we might experience again. With so many people being in their cars, we essentially know so many people are kind of not getting the same level of physical activity they could get. Just as an example of that too, we know from the research that people who take transit often get at least half of their kind of their recommended physical activity guidance in any particular day, just by that simple act of taking transit, walking to and from, and knowing the activity that's in between. And that's something, again, that we can build into our lives and kind of get closer to those standards and healthier outcomes for people. And so for the third part that we mentioned was this idea of looking at essentially what are some of those physical elements when we think about crashes and the roles that they play. A pivot here is sometimes in transportation, we really focus on what's happening, essentially where crashes have occurred, what type of crash, not always thinking about the outcomes that are associated with that crash. And so you can see some of the things here that we really think about in a visceral way and the health way when we think about crashes. So that idea that bodily physical harm that can happen if you are essentially as a bicyclist or pedestrian hit by a vehicle. If you're in a car, what can happen to you? Say you find yourself in a crash, particularly one that can bring you injury or one that lead to fatality, so directly impacting you that way. So you can see this no matter if you're a vulnerable road user, somebody who's a pedestrian or bicyclist, or somebody who's in a vehicle, there's a lot of physical activities, both in kind of physical impacts that can both occur within the moment of the crash, but then can follow you throughout your life should you find yourself disabled or dealing with an injury, a chronic injury following that crash. And again, the way to kind of place it in the body and to think about the impacts that it could have, neck, brain injuries, head injuries that we can see, bone injuries and spine injuries that we can have, as well as those that can really affect our mobility, affecting our kind of hip and pelvis damage as well too. And so again, if you're lucky enough not to be adversely or potentially really worse off from a crash, you can find yourself dealing with some chronic diseases and some chronic health impacts from being involved in a crash. So we just wanted to talk a little bit about what that data looks like for Massachusetts. When we're talking about air quality and we're talking about physical activity, maybe they weren't as easy to see some of those impacts on the body, but we can see that a lot more clearly when we think about the crash data itself too. So you might be looking at some of this information yourself too, but you can see here the number of serious injuries and fatalities that have happened with bicyclists and pedestrians over the years. And so again, these are all things, at least from the public health side, from a preventative upstream view, these are all things that are potentially preventable and don't have to happen within our systems. They're not an acceptable health cost that we have to have as part of this. And again, too, we can see that that's a real kind of spread in terms of where these things happen and how they affect people too. And so while it's good to look at this with any one particular municipality, I think we all realize that our transportation system plays a much larger role than any one city or town. It's something that's serving us regionally. And so it's a way for us to look collectively of where we might have effect, and what are some of those standards and kind of goals we might aim for as preventing some of this work. And keeping in mind essentially what are those key locations that we can influence from the transportation side of things, whether it be intersections, and particular places where we have a number of different modes of transportation all coming into the same place in a collective and potentially impactful manner. So I'm going to pause there, just do a quick check to see if there's any clarifying questions, and I'm going to turn it back over to Sharon.
I don't see any questions in the chat box at this time.
Thanks, Betsy.
Barry, do you want to take us to the next slide?
Yes.
So with impact modeling, we're trying to estimate the interactions of those 3 exposures that we just looked at. So here we have a scene, and it's sort of just representing that you're not just by getting physically active. You may be walking and putting yourself at increased risk for traffic injury, traffic accident. You're also likely getting physically active, at least in an urban setting or any near roadway setting, close to transportation related air pollution, and are increasing your exposure to that by getting physically active. And I'm just going to pause here and say that the research really does show that any benefits related to physical activity outweighs the detriments of air pollution exposure, but that we want to, with health impact modeling, account for some of those interactions. And I think another important thing to note in these interactions is something that I've been pointing to throughout this presentation about air pollution, is that there's different susceptibilities for each of these exposures. So if we look at that young child or the older adult, although they may be breathing the same air as the skateboarder, the effects of those exposures is going to differ. So this is one of the things that health impact models can account for. Those age-specific relative risk factors is what we would call them. Next slide. So this is just to revisit this idea that the policies that we all are working on as urban and transportation policy and planners has impacts on health outcomes. We are seeing that changes to the environment can shift behavior, and it does through that. So through a variety of pathways, but the ones that we're most interested in terms of transportation and in terms of health impact modeling are motor vehicle crashes, air pollution, and physical activities, and that we are going to be looking at health outcomes related to premature mortality and morbidity. Next slide.
I was just to say thanks, Sharon, for presenting these two. And I think just to reiterate too, that I think sometimes these graphics can also make the impacts in the work seem siloed. And while this is a way to help us understand it, I think we want to be very clear that it's thinking about the cumulative impacts and how these kind of interact and layer on top of one another.
Yes, that's a good point. Thank you, Barry. And feel free to jump in at any time. So this is just meant to be a teaser for next session. I don't expect you to try to read this graph on a PowerPoint slide, and we will send it around after this conversation. But I wanted to share this table with you to set the stage for our next conversation and give you a better understanding of what we're talking about when we talk about health impact modeling. To set the stage, across the top, you're going to see some columns in blue, some columns in red. Blue is input, red is output. Rows represent different health impact modeling tools. So you look at them and you recognize that each of these models are going to look at different exposures and also different outcomes. So most are going to focus on health benefits related to active transportation options, and a lot will only consider death-related, mortality-related outcomes. The one that you've already heard Barry and Betsy point to as the one that we are going to talk to about in greater detail is ITHIM on the bottom, or the Integrated Transport and Health Impact Modeling Tool. It's a mouthful. And this is a tool that we have worked with a team of researchers that we shared up front to calibrate for the Massachusetts area. As you can see, if you look across those blue and red columns, it's a little bit more comprehensive and complex tool than some of the other models, and it includes more of those inputs and outputs that we look to measure and estimate. Next slide.
Yeah, and it's okay. And I was going to add too that I think one of the things for terminology too, and sometimes in public health we'll talk about mortality and morbidity, being that idea of both kind of mortality where we might see or expect deaths, and morbidity where we might essentially kind of lifelong health impacts, things that people will have to live with. So just to clarify that language.
Yes, public health jargon, it's dangerous. So as again, a little teaser about ITHIM, we will talk about this and the other models more next time, but just speaking to what ITHIM is, and what it is not. It is a comprehensive tool, which means that it will estimate the interactions of all three of those exposures: air pollution, physical activity, and traffic safety. But it is a comparative model. So you're going to be looking at, with ITHIM, changes in between different scenarios. So what is the health difference between a baseline scenario of what we're doing today versus if we were to triple the amount of trips that people were taking by bike and ped? What would be the impact on health and disease burden, which is just to say it cannot predict or determine changes for you. The tool that we will share with you has been calibrated to draw on data collected and aggregated at the MPO level for Massachusetts, and breaks that down by age and sex data from the census. And we will share a little bit more of what that looks like next time, but it is an Excel workbook with around 35 worksheets only, which will show you how to modify. And so next slide. This is just to review ITHIM and show that the pathways that ITHIM follows from environmental changes to health outcomes is very similar to the pathways that we think about when we think about changes of built environment to health in general. I will say that the one place where ITHIM really focuses in is that we today discussed about a huge number of health outcomes related to those three exposures, but ITHIM focuses on those that have the strongest causal evidence. So this is including respiratory diseases, cardiometabolic diseases like diabetes and heart attacks, mental health, again, dementia, depression, and then cancers, specifically of the lung, breast, and colon, and accidental injuries. And to the point that Barry just made, ITHIM offers us some nuance in that it includes mortality, but also morbidity. And it's looking at not just premature mortality, but what is the impact on your quality of life if you were to, say, develop asthma as a young child and then have to live with that over the course of your life. How will that reduce your lifespan, but how might that also impact the number of good years of life you're living? So all of that will be the focus of our next conversations. So with that, next slide, Barry. I want to thank you all for joining us on this 45 minutes overview of the connections of transportation and health, and hope that you will join us for the next 2 meetings. The next one will be next Tuesday, the same time, and we will be looking at an overview of health impact models and starting to talk a little bit more about ITHIM and how it works. Barry and I will follow up with everyone on here with a recording of today's meeting, but also with some pre-reading if you're interested in learning more before our meeting. But in the meantime, if you have any questions or comments that we don't get to today, because we're going to leave about the last 15 minutes for your questions and comments, we would encourage you all to email either me or our very gracious host, Betsy. So with that, I will see. Betsy, has there any questions that came up?
Yes, there has been one. Casey, do you want to?
So Bruce has his hand raised, and then Kathy asked a question.
Why don't we start with Kathy?
Okay. Kathy asked a little bit ago if this includes looking at ports and rail yards. I'm assuming she's thinking like if the model would take into account the emissions from ports and rail yards, but I'm not entirely certain.
Do you want to take that, Sharon, or do you want me to take it?
I will start and you can add on.
Right.
Yes, it does. It doesn't look at just air pollution related to air to near roadway. It looks at modeled levels of air pollution, specifically particulate matter, PM 2.5, across all of Massachusetts.
And that said, we can follow up some more too. I do think when it then, if that's the base case, I think it does then look about the traffic related contributions and detractions from that amount and the effect that would have too. But we can do a little more looking into that part of it. But I think if the modeling data is capturing some of those effects, there should be places that you could put inputs into the system.
Great. Kathy, if that doesn't answer your question, let us know. Bruce, I'm going to unmute you when you can ask your question.
Thanks. I was busy typing, and I guess I didn't get to finish it. You beat me before I finished typing a question for you. So I was going to say, this is the second webinar I've attended in the past week where the danger of particulate matter is underscored. And as someone who does, travel demand modeling and looking at other things, PM and VOC have kind of been the poor stepchildren of emissions related to transport. The focus has been on CO2 reduction and CO reduction and NOx, and PM is done kind of as an afterthought. It's, I'm just even thinking of like our models, it's like all the way on the right, you kind of have to pan over to look at it. One, how did this emerge, at least historically? And two, does the new model you're going to show us help to better capture these? Because again, hearing reports from health professionals telling me how awful PM is, it's like, well, why are we focusing on these other things and not PM? So.
Can you take that, Barry?
Maybe start. You may have been closer to that.
I think you raised really good points, Bruce, and I will say that PM 2.5 is regulated, but a lot of those very small particles, which we're often most concerned about in terms of health outcomes, are not regulated, which is why, therefore, not monitored. And so it's often why they're not part of conversations, is because we don't have good data on what they are. And even in this model, we rely on PM 2.5 data because that's a criterion pollutant that we collect data on. And so it's sort of like the best available data. What are the other factors of that question?
I guess the one thing I would add to that too, and Bruce definitely push back if it's what you already know or different than what you know. But I do think to Sharon's earlier point about kind of causal relations, I think at least in the health literature, there's been a lot of like strong emphasis on kind of where there are strong causal connections, and particulate matter seems to be a place where that's very, very well established, and in some cases I think has driven some of those drops in some of the like the NACs and the kind of the levels that are acceptable. And so I think that may have been part of it, that long history, and plus maybe some of the measurement tools that might be available to capture it.
And I will also add on to that a lot of these other criterion air pollutants are more regionally dispersed. And so while they are considered serious concerns for our health, particulate matter is often discussed when in transportation conversations because it decays pretty rapidly. So about 500 500 feet outside of a highway, you're going to expect to have exposures that are much lower. So that's just speaking to why it's relevant for a transportation conversation. But when you think regionally, why we would consider those other pollutants. And Connor added things in here too. I was thinking that Connor might want to have also a source of information. So Connor, I'm just going to read your comment aloud, but if your hand's raised. Oh no, but if you want to add more, feel free to raise your hand. He notes that there's a strong correlation between NOx and ultrafine particulate emissions, which are those which are less than 0.1 microns, and the latter not being regulated, but it's also implicated strongly in a range of health impacts. Thank you, Connor. I'm gonna, yeah.
Okay, thank you.
Thank you both. It looks like Anne is raising her hand. Should we take her?
Okay, I'll unmute. Anne, you're unmuted. Go ahead.
Okay, can you hear me?
Yep.
Yeah, okay. So I just wanted to add, Bruce, that the reason we don't do it as part of for the modeling, is because we're in attainment for particulate matter. And as Sharon said, that PM 2.5 and PM 10 and CO are really hot spots, and it is really right at that location that that people are affected by it, and then it disperses. But we don't, in our modeling and what we do for the plan and for your projects, we don't really, we have the emission factors there and we can calculate them, but because we're in attainment for particulate matter, we don't really report it. So, but we do, I know, and I think Scott, if Scott's on the call, I think the MBTA wants us to report PM because of the diesel and, you know, that type of information, or that, you know, the information from those types of analyses that we do. So that's the reason we don't do a lot with it, but it doesn't mean that it's not a health issue.
Thanks, Anne. Does anyone else have a question they like to ask or add on to anything that's been said? Okay, well, in the last couple of minutes, as we close out the last few remarks, feel free to add to the chat box or raise your hand and we'll get to you as we still have a couple of minutes remaining. So as Sharon said, we have the next presentation next Tuesday, and hopefully this was a good teaser at the end of the presentation to get you interested and intrigued by the actual model itself. There will be a presentation. We'll send that out to you as a record of the presentation. We'll send that to you as well as some material for you to refer to if you'd like in between this presentation and the next one next week, since there is is a lot to it. So feel free to look through it and get familiar with the model a little bit. So thank you everybody for attending, and thank you so much to Barry and Sharon for putting the time in, and to Casey and Anne for helping facilitate and put together and coordinate with everybody on this. So if nobody has any more questions, we can end it and see you all in 7 days.
Okay.
Okay.
Bye, everyone.
Bye.
Good seeing you all. Thanks, Casey. Thanks, Betsy. Thanks, Ann. Thank you all.
Great.
Bye, Sharon.